the story of Harold Shipman, integrating the clinical evidence, psychological profiling, and investigative details that made his case one of the most chilling in criminal history. This account draws on documented evidence, court findings, and psychological analysis, avoiding speculation while presenting a vivid, factual narrative. And before we continue, please subscribe to Behind the Veil, this channel. We appreciate your time and effort. Enjoy the video. The case of Harold Shipman, the Doctor of Death, the man behind the mask. Harold. Frederick Shipman, born January the 14th, 1946, in Nottingham, England, was a respected general practitioner, GP, in Hyde, Greater Manchester. To his patients, he was Dr. Fred, a dedicated doctor known for his attentiveness, particularly to elderly patients. But beneath this veneer of care lay a predator who exploited his position to commit murders on an unprecedented scale. Over 23 years, from 1975 to 1998, Shipman killed an estimated 250 patients, primarily elderly women, making him one of the most prolific serial killers in modern history. From a forensic psychology perspective, Shipman's early life offers clues but no definitive origin story for his crimes. Raised in a working-class family, he was intelligent but not overtly troubled. His mother's death from lung cancer in 1963, when Shipman was 17, was a pivotal event. He witnessed her receive morphine injections for pain relief administered by a doctor at home, an experience that may have shaped his later modus operandi. Psychologically, this could suggest a fixation on control over life and death, though no single event explains his pathology. Shipman's personality was marked by arrogance, a need for control, and a lack of empathy, traits consistent with narcissistic personality disorder, though he was never formally diagnosed. The method: lethal injections and betrayal of trust. As a forensic scientist, the physical evidence of Shipman's crimes centers on his use of diamorphine, pharmaceutical heroin. Shipman administered lethal doses during routine house calls, often under the guise of treating minor ailments. Victims were typically found dead shortly after his visits, often in their homes, seated or lying as if they had simply passed away. Forensic toxicology was critical in unraveling his crimes. Diamorphine metabolizes into morphine in the body, and post-mortem toxicology reports on exhumed victims confirmed morphine levels far exceeding therapeutic doses, often 10 to 100 times what would be prescribed for pain management. Shipman's method was chillingly efficient. He stockpiled diamorphine, likely from excess prescriptions or deceased patients' supplies, exploiting lax oversight in 1970s, 1990s UK medical practice. His medical records were meticulous yet falsified, often documenting fabricated symptoms like chest pain or respiratory issues to justify morphine use. As a forensic scientist, I'd note the absence of external injuries or signs of struggle in most cases, consistent with victims' trust in their doctor. This trust was Shipman's greatest weapon, allowing him to kill without immediate suspicion. The killings, scale and selection. Shipman's confirmed victim count is 215, with an estimated total of 250 based on the 2002 Shipman inquiry, a comprehensive investigation led by Dame Janet Smith. Most victims were elderly women, aged 60-90, though some men and younger patients, the youngest being 41, were also killed. His selection criteria remain psychologically puzzling. Elderly women may have been targeted due to their vulnerability, social isolation, or perceived lack of scrutiny over their deaths. However, no sexual or overt sadistic motives were evident, distinguishing Shipman from many serial killers. His killings appeared clinical, almost procedural, suggesting a compulsion driven by control or a godlike complex rather than emotional gratification. Forensic analysis of death certificates revealed patterns: an unusually high death rate among Shipman's patients, often certified as natural causes like heart failure or stroke. Statistical anomalies, such as deaths occurring shortly after Shipman's visits, often in the afternoon, raised red flags. The inquiry found that Shipman killed at least 171 women and 44 men, with many cases likely undetected due to cremation or incomplete records. The investigation: uncovering the truth. In 1998, the death of 81-year-old Kathleen Grundy, a healthy and active former mayoress, raised concerns. Her sudden passing after a visit from her doctor seemed unusual to her daughter, Angela Woodruff, a lawyer. A will leaving $386,000 to her doctor was found to be suspicious. Forensic analysis revealed the document was created on a typewriter linked to the doctor's office, with handwriting inconsistencies suggesting forgery. Local undertakers and a colleague, Dr. Susan Booth, noticed an unusual number of patient deaths under the doctor's care. Police investigations, including toxicology reports from exhumed remains, identified irregularities in multiple cases. Discrepancies in patient records and medication logs further supported the case, leading to a thorough forensic review. Psychological profile: understanding the behavior. From a psychological perspective, the doctor's actions suggest a complex individual. Unlike typical high-profile offenders, he was reserved yet authoritative in his professional role. His behavior indicates a possible need for control, using his position to manipulate outcomes. His dismissive demeanor during investigations and lack of explanation for his actions suggest confidence in avoiding accountability. Despite a stable family life with a wife and 4 children, an earlier incident involving forged prescriptions in 1976 hints at a pattern of exploiting medical systems, though no serious crimes were tied to that event. The trial and aftermath. Arrested in September 1998, the doctor was convicted on January 31, 2000, for multiple charges and sentenced to life imprisonment without parole. On January 13, 2004, he died in his cell at Wakefield Prison 1 day before his 58th birthday, leaving many questions unresolved. The subsequent inquiry prompted significant reforms in UK medical oversight, including stricter regulations on controlled substances, improved death certification processes, and enhanced monitoring of medical professionals. Final thoughts. This case highlights the vulnerability of trust in professional systems. The doctor's precise methods, manipulating records and leveraging medical authority, delayed detection until patterns emerged. From a psychological perspective, his calculated actions and lack of accountability underscore the risks of unchecked power in trusted roles. His actions left a lasting impact on the medical field, prompting reforms to prevent similar breaches of trust. Thank you for reading, and please share this video to raise awareness. Stay informed, and we'll see you next time.